Welcome, everyone. We're going to give everybody a minute to join and start just after the hour. All right. Welcome to the American Heart Association's Data Submission 101 for 2026 Outpatient Award Achievement. We do have a lot to share with you today, so we'll go ahead and get started as everyone is still hopping on. As a reminder, this meeting is being recorded and slides will be available to all registrants after the call. If you have questions during today's call, please plug them into the Q&A feature and we will try to respond throughout the webinar or when we get to the Q&A section at the end of the webinar. Please keep an eye on the chat for helpful links from Heart Association staff. If you have any questions following the call, please feel free to contact us. You can use the bit.ly link here or find our contact us form on any of our program websites. You can also contact our platform vendor at IQVIA for user support on the data platform. We'd like to thank you again for joining us for this Data Submission 101 webinar, which is hosted by the Outpace CVD team. Outpace CVD is the American Heart Association's suite of outpatient programs that include Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. Outpace CVD aims to provide QI support and recognize your organization's commitment to improving outcomes of cardiovascular disease. This webinar today will specifically be focused on the data submission process. I'll be kicking us off today by introducing our team and then quickly running through the agenda. My name is Liz Montgomery. I am the Senior Program Consultant for the Outpatient Quality Team at the American Heart Association. I'm joined in presenting by my phenomenal colleague, Allison Smith, who is a consultant for the American Heart Association. And we're also joined in the chat and Q&A by Rebecca Alicki, who is the Director for Program Implementation for all of quality at the Heart Association. On today's call, we'll begin with a shout out on last year's award achievement. Then we'll move on to the bulk of our content, which will focus on data submission details and criteria, especially where we have seen updates this year. We'll share a quick demo of how to submit data and then highlight our key resources and tips for data submission. At the end, we'll have a little bit of time for Q&A. Before we get started, we would love to know a little bit more about who is joining us today. Is your organization submitting data for the first time in 2026? Or are you a returning organization? Or maybe you're not sure, you're joining today and someone else signed you up for this. Been to about half submitting and we have a lot of returning organizations, but a few new organizations as well, which is wonderful. But just another 5 seconds and then we'll close the poll. All right, I think we can go ahead and end the poll. We have nearly 80% who have previously submitted data, which is really exciting. Go ahead and move forward here. And one reason why it's so wonderful to see so many organizations is that I can thank you for your participation in previous years. I'd love to highlight that we had a record number of organizations participate in one or more of our Outpace CVD programs last year. Over 2,400 organizations representing more than 38 million patients participated in 2025. This is truly a phenomenal effort, and we are so grateful for your continued engagement. Now, let's go ahead and get started on a quick refresher of some key data submission reminders. Beginning with our timeline. Right now, you can submit, edit, and revise your 2025 data in our online data platform. The deadline for data entry this year is Friday, May 15th at 11:59 p.m. Eastern Time. Data will be captured at exactly midnight Eastern Time, which is 1 minute after the deadline, to determine award status for all sites. Next, American Heart Association staff will be reviewing and validating the data submitted to classify awardees by award level. You might hear from us during that time, which is mostly in June, if we have any questions about your submission, and your response will help us confirm your appropriate award level. During the fall, we'll then notify 2026 awardees with your congratulations email, promotional toolkit, and celebrate your accomplishments on our program websites. The recognition doesn't end there. We do have additional opportunities to highlight awardees at scientific sessions and at certain local and regional events. Keep in mind as we get started that there are two general steps to submit data for award achievement. The first step is to register. This enables us to create a profile and user login for you in the online data platform. If your organization is new to submitting data, you can go to heart.org/registermyoutpatient.org to register. Now, if you have already submitted data before and you already have a profile, as many of you do, you will not need to re-register. You can skip straight to entering data, which we'll cover next. But on that registration form, we're going to ask you some basic demographic questions and, importantly, what programs you wish to register for. You can go ahead and register for all three at the same time, and if you're considering participating in any of the three, I would encourage you to select them all. That way, if you do decide to add additional programs later, they'll already be in the platform. But if you are returning and you would like to add a new program, you will need to re-register to add that to your organizational profile. We'd like to note that one registration equates to one potential award. If you want your health system and each of its individual locations to all be listed individually and each receive a certificate for that specific site, then you would need to submit registration forms for each of those sites. If you want to register 5 or more sites, there is a multi-site submission process in the registration link that'll save you a little bit of time. The second step is going to be to submit data, and that's going to start by logging into our data platform. You'll navigate to Program Forms, hit Add New, enter 2025 because you're entering data from calendar year 2025. You'll fill in all of the fields, check the Data Entry Complete checkbox, and then save and exit. You'll be able to save and return to revise your data up to the May 15th deadline. Now, I know this is all a very simplified lens of data submission to give you a little bit of context, but we will dive in a little bit deeper later in the call with some screenshots and some additional resources that break this down to the tiniest step. I also want to encourage you, before we really dig in though to the details, to submit your data earlier in the submission cycle if it is at all possible. The reason for this is that we want to make sure that we can provide you with the best support available when troubleshooting any errors. This might be a confusing question you need support answering, or it might be a technical issue like uploading your data. As you can see here, we tend to get the vast majority of our data submissions in the final month, and our team is supporting nearly 20% of all data submissions on the final day. Our team's going to do the best that we can to help you get your data in on time, no matter when you submit. But if you do submit a little bit earlier, we'll be able to be more hands-on just because we have a little bit more capacity to do that. Now we can get started by walking through some of the basic data submission criteria. First, who is eligible for an award? We have a pretty broad range of outpatient organizations that participate in Outpace CVD. But the fundamental criteria is that your healthcare organization, as you registered and as you are submitting data, must directly diagnose and manage patients with these chronic disease conditions. This means that your organization must both be prescribing and managing the medications of patients with these conditions. It also means that if you are primarily a screen and refer organization, you would not be eligible for an award. Our quality improvement tools and resources do remain freely available to anyone who finds them helpful, so you don't need to meet this eligibility requirement to use our resources. Next, our program forms include 3 basic categories of questions that we'll break down as we go through each program. Each program asks for basic demographic details for your organization. These are going to remain consistent across each of the 3 programs. Next, we'll ask for measure specifications that align with CMS measures. There is some overlap between some of our programs on these measures, so we'll highlight which we're looking for in each program. Please note that while we use the CMS measures for our program, we do not set the measures themselves. And then last, we will ask about your clinical practices. This section of the program form serves several purposes. First, it acts as an annual self-assessment of your organization, and it can be a useful tool in guideline-based activity improvements. It can also help the Heart Association understand where organizations are facing challenges or having successes. This way, we can continue to build upon the QI tools and resources that we're offering to meet you where you are. We recommend that you stay in touch with your local Heart Association representative or sign up for our newsletter to stay in the loop for when new resources are released. The demographic information collected, as I mentioned, is identical across programs and can be copied and pasted from one form to the other. We're going to ask you for your total adult patient population. This should be looking at patients with a visit in 2025 where their chronic disease risk factors could be managed. So, for example, you're going to want to exclude visits like acute care visits where hypertension would not be diagnosed or managed for target BP. Then we'll ask for a breakdown of that total population by race and ethnicity. This is based on a simplified version of Table 3B from the HRSA Uniform Data System reporting requirements for 2025 health center data. We'll also ask for a breakdown of that total patient population by the patient's primary payer. And we'll also ask for your total number of providers. Now, as we go into more measure specifications and additional details, I'm going to pass it over to Allison to walk us through target BP.
Thank you very much, Liz. Great. Thank you for the introduction. I want to walk through both the measure specifications, the clinical practice attestations, and the award criteria for each of the target BP and check change control cholesterol programs. So starting with target BP, for those of you who have submitted before, there are no changes to this measure specification. We use CMS 236, the controlling high blood pressure measure. As you may well know, the denominator for that includes patients 18 to 85 who had a visit during the 2025 calendar year and a diagnosis of hypertension either before that year or in the first 6 months of the year. The numerator for this measure includes patients from that denominator who also have their blood pressure controlled to a level of less than 140 over less than 90. Note that that is higher than a guideline recommendation control level, but that is what the measure steward uses as the cut point for determining control in the performance measure. I should use this example just to call out there are a few scenarios here to figure out who should be included or not. If a patient had a visit in March and was diagnosed in March, they would be included in your denominator. If a patient was seen in October and diagnosed for the first time in October of 2025, that patient would not be included. And the logic here is that you don't have enough time to get perhaps that patient's blood pressure controlled. And so they're excluded in the 2025 data submission. However, they will be in your 2026 data submission, just as an example. We do also ask a question whether or not you're including remote patient monitoring measurements, those used that you gather through self-measured blood pressure monitoring. That just helps us understand. And that is permissible according to the specifications. The one thing I'll also note, if you're calculating your control rate, your MIPS 236, using your EHR or your population health tool that does it automatically for you, that's one thing. If you are doing it manually, make sure you read the detailed measure specifications. Make sure you exclude patients such as those who are pregnant, those who are in palliative or hospice care, and there are other exclusions like that, that you certainly want to continue caring for those patients and managing their hypertension, but they're not included in this particular performance measure. So moving on, I'll talk a little bit about the practice attestations for target BP. If you could go to the next slide, please. The pillars for target BP, it may be very familiar to you, and those remain the same. There are 30 attestation questions to ask about your systems of care and the substance of how you deliver that care as it relates to measuring accurately, acting rapidly, partnering with patients, self-measured blood pressure monitoring, and equitable health outcomes. Those attestation questions are essentially the same, and I just want to highlight a few little tweaks that were driven by the advent of the 2025 AHA/ACC high blood pressure guideline. So in the Act Rapidly pillar, you can see the third attestation question down asks, in the context of your treatment algorithm, do you specify a treatment goal of less than 130 over 80 millimeters of mercury? The asterisk is what has changed in this, and it really is for all patients, with additional considerations for those who are pregnant, require institutional hospital care, or have limited life expectancy. And that is how that treatment goal, that sort of universal treatment goal, is recommended in the new 2025 guideline. In the Partner with Patients pillar, the updates this pillar really focuses on the assessment and intervention to support change in modifiable lifestyle risk factors. The guideline newly added a recommendation around assessing and intervening to support patients in reducing stress. And so stress was added to the behavioral modifiable lifestyle risk factor assessment questions, attestation questions, along with alcohol and tobacco. And so both assessing and intervening around stress in patients is an important addition to note. With that, I'll move to the award criteria on the next slide. The award levels for target BP are the same as previous, and that includes Gold Plus for organizations that have a blood pressure control rate of 70% or greater using the MIPS measure, and who also have attested to at least 4 out of 6 of the attestation questions for the Measure Accurately pillar, the Act Rapidly pillar, and 1 additional pillar. The gold level award is the same, again, award recognizing organizations who have a blood pressure control rate of 70% or greater. The Silver Plus Award is for organizations who can attest to both at least 4 out of 6 attestation questions for the M, the A, and 1 additional pillar. The Silver Award is for organizations who are able to attest to 4 out of 6 of the M pillar. And then the Participant Award is reserved for first-time data submitters to really acknowledge their commitment in improving blood pressure control. And every submitter is eligible for 1 of these awards, depending on their level of performance. So with that, we'll shift gears and talk a little bit about check change control cholesterol on the next slide. And again, we'll talk about the measure specifications, the attestations, and the award criteria. So on the next slide, we'll move to speak about the measure specifications. Similar to previous years, this uses MIPS 438, the statin therapy for prevention and treatment of cardiovascular disease criteria. In the denominator for this measure, you'll want to report the number of patients meeting any four risk group criteria. And I'll talk about those in a minute, but I just want to flag that there was an addition of a fourth risk group criteria to consider in your data submission and determination of the size of your denominator for this measure. The numerator for this measure looks at the total number of patients who are actively using or have received a prescription for statin therapy at any point during 2025, the measurement period. So in the next slide, we'll dive into those four risk groups that can make a patient eligible for the denominator of this measure. The first is for all patients who have been previously diagnosed or have an active clinical diagnosis of atherosclerotic cardiovascular disease, ASCVD, including that of an ASCVD-related. The others are related to patients who are at high risk. And so the second grouping is for patients aged 20 to 75 at the beginning of the measurement period who had an LDL of greater than or equal to 190, or who were previously diagnosed or have a current active diagnosis of familial hypercholesterolemia or FH. The third group are patients aged 40 to 75 at the beginning of the measurement period with type 1 or type 2 diabetes. And the fourth potential grouping for inclusion is patients 40 to 75 who are at the beginning of the measurement period with 10-year ASCVD risk of a score of greater than 20%, greater or equal to 20%. And that's using the pooled cohort equation, not the prevent calculator. Again, these are specifications determined by the measure steward, not the American Heart Association. So these are if your patients meet any four of these groups, they should be included in the denominator for this measure. And then based on the use of statin therapy would determine whether or not they're in the numerator. So moving on, I want to touch on some of the other attestation questions that we have for check change control cholesterol. This is updated slightly, and it's really merged some of the existing questions, really looking at how you use risk assessment in your practice. So the first pair of questions asks whether your organization calculates ASCVD risk in the EHR, meaning it's built into your EHR, or perhaps you calculate it outside your EHR using an app or some other tool. And so this is you're either choosing one or the other. Either it's embedded in your EHR or it's done externally. For the next pair of questions, it's asking where that is documented in your EHR. Is it in a field that's dedicated for ASCVD risk score documentation in a structured field, or is it something that you put in a unstructured field like a notes field? So again, either or. Is it in a structured field or a generalized note field? And then the remaining questions ask whether your clinician is discussing ASCVD risk estimation results with your patients, and then the options of none of the above or I'm not sure. So then moving on, there are two other questions that we ask. One is, again, there are no changes to either of these, asking your organization's adoption, how you operationalize a specific treatment plan for managing very high-risk patients. And there are some options that you can select all that apply to your practice. And then similarly, there's a question asking how familiar you are with the new prevent calculator. And again, that's a one response option, a single select there. So with that, we'll talk just briefly about the award criteria or levels that are available for check change control cholesterol. These are the same as previous years. There is a gold status award for organizations who have achieved, both fulfilled the basic criteria of participation as well as have 70% or more of their adults who are at risk appropriately managed on statin therapy based on the specifications of MIPS 438. And then the participant status award, recognizing organizations who have submitted data and are really committed to ASCVD risk reduction in both their assessments, their implementations, and their clinical workflow. So with that, I will turn it to Liz, who's going to touch base on target type 2 diabetes. Thanks.
Thank you so much, Allison. Of our three programs, Target Type 2 Diabetes has definitely seen the most significant change in 2026, so happy to spend a little time here. The measure itself changed only a little bit. We continue to ask for CMS MIPS 01, but you'll note that the name of the measure changed from diabetes HbA1c port control to diabetes glycemic status assessment greater than 9%. The denominator continues to ask for patients aged 18 to 75 years who have diabetes and had a visit during the measurement period. The numerator now asks for the total number of those patients whose most recent glycemic status assessment performed during the measure period is over 9% or is missing or was not performed during the measure period. This is a change as last year only HbA1c was accepted and now GMI is also accepted. Please remember when you're completing this measure that unlike the two measures Allison just walked through, this is an inverse measure. So a lower performance rate is going to indicate a better performance. Additionally, because Target Type 2 diabetes, the program is focused on cardiovascular disease risk in patients with diabetes, we also ask for an additional measure submission. This can be either MIPS 236 or MIPS 430H, which are both the measures that Allison just walked through. So you can submit for one or the other or both wherever you have the highest performance. And please remember that when we do ask for these additional measures as part of Target Type 2 diabetes, we want you to continue to use the measure specifications. This means you do not need to narrow the denominator to patients with diabetes. You can just copy and paste from the other programs if you are participating or follow the measure specifications if this is the only program that you're participating in. Moving on to the clinical practice questions, this is really where we had the greatest change from 2025. Many of our questions have overlap to the ones asked over the last several years, but we have refined the structure of how they are asked to better point to quality improvement opportunities and align across programs with the structure of Target BP. We begin our attestation questions asking which guideline-directed treatment and prevention efforts your organization deploys for patients with prediabetes. This is included because, well, yes, the program is focused on patients with type 2 diabetes. We recognize that a focus on diabetes prevention is a really important part of the care process. So please answer this to the best of your ability. You can select all that apply, but know that the answer to this question is not going to affect your award level. Next, we have established 4 pillars of Target Type 2 diabetes. These were announced in July of 2025 when we held a webinar that went into significant detail on each of the questions. If you'd like that in-depth exploration of the questions, I'd really recommend that you check out that webinar or our pillar toolkit, which we'll also be highlighting later in this call. Each pillar has 6 sub-questions. Much like Target BP, they are organized into a policy element, a practice assessment element, and key criteria that should be part of the policy and practice. Our Target Type 2 diabetes pillars focus on assessment, treatment, patient partnership and lifestyle modifications, and equitable health outcomes. Participant status, I'll move on to the awards here too. They mirror our awards for check change control cholesterol in that we have a participant status and we have a gold status. That participant status recognizes any eligible organization that has completed their data submission and answered all of the questions within the clinical practice questions as well. Gold status recognizes those that also reach a performance rate of less than 25% on MIPS 1 and above 75% on either the blood pressure or the statin therapy measure. So there are multiple measures that need to be met in order to achieve gold status for Target Type 2 diabetes. I will note that following this data submission cycle, we will be evaluating the performance on those new evidence-based activities pillars and determining updates to our award criteria. We look forward to announcing that this summer, but those awards won't go into effect until next year's data submission cycle. So they won't affect the data that you're submitting now. We're just going to learn from that data and use it to improve our awards for 2027. Before we roll into our quick demo of submitting data, I wanted to pause on three key takeaways. First, remember that our deadline is May 15th. Next, remember that if you are already registered, you don't need to re-register unless you're wanting to add a new program access. And then finally, please always remember that you can reach out to us at any time using our Contact Us form. Next up, I'm going to provide a quick walkthrough of what data submission will look like, and I'll be using Target BP for this example. You'll begin by logging in on the data platform at aha.infosarioregistry.com/login. If it's been a while since you last logged in, understandable. You can use the forget password or need help options, or you can reach out to your local staff member for support. They can always help reset a password or add a new member of your organization if more than one user is needed for your account. If you're submitting for multiple locations, you'll see a view like this once you log in. You can just select whichever organization you would like to view by clicking on the name. This will bring you to your community page. If you only need to submit for one site, then you'll be taken directly to this page and you won't see the previous view. You can view helpful navigation tips on the top right of the community page. You can access helpful resources in the library. That's going to include most of the resources that Allison is going to walk us through in the next section. So if you're just in the platform, you can click to the library to basically go directly to those resources. And when you're ready to submit data, you're going to use program forms, which you can access under Get Started or on the left-hand navigation bar. So that is where we're going to go next. So this is the program forms page. And under Edit Forms, you'll see any forms that have previously been opened and saved. Once you begin the 2025 form and save it, you will see it here and you can return at any time to edit your data. You're going to click Add New next to the desired form to start your data submission. Note that you're only going to see forms for programs for which your organization is registered. So if you've only registered for Target BP, you won't see check change control cholesterol or Target type 2 diabetes under Add Forms. After clicking Add New, you'll be asked to type in a reporting year, which will correspond to the measure year that you're submitting data for. So you'll type in 2025 and hit Submit. This will bring you to the program form. Detailed instructions are going to be at the beginning of each program form, and you're going to need to complete all of the tabs that are listed on the right. Target BP has 3 program tabs, which you can see here, as does Target type 2 diabetes, but check change control cholesterol has only 2 tabs. And make sure that you don't forget to save as you go. Just a heads up, the form does not automatically save, so you do want to save regularly so you don't have to go back and re-enter your data. A yes is going to be required for both the first and second question, ensuring that you're meeting our minimum eligibility requirements in question 1 and that you are a designated representative in question 2. Question 3 is where we will ask you for that total adult patient population, which again is going to later be broken down by race and ethnicity and payer groupings. And then for Target BP, questions 4 and 5 on that first tab are the measure criteria. So as a reminder, this is measure 236, controlling high blood pressure. And there will also be a follow-up question on whether or not telehealth readings were included. Also on the first tab, as I mentioned, are those breakdowns by race and ethnicity and by payer group. These are asked in table format, and each will auto-populate in the gray box at the bottom. And that gray box does need to equal your answer to question 3. If it does not equal the answer to question 3, it's going to create an error that'll keep you from saving your form. If you need to find what's causing the error, you need to go back and figure out why the math isn't working. You can just delete one of the rows that'll let you save the form and come back later once you get the details straightened out. The next two tabs will include the pillar attestation questions. So the pillar evidence-based activities that we highlighted earlier. All questions under each tab does need to be completed to be eligible for an award. And once you have finished answering all of the questions, you're going to return to the first tab and click on the data entry complete checkbox. If the checkbox is clickable, awesome. It means you're all set. Everything has been done as it needs to be done. But if you can't click on the box, then it means you probably have missed a question. So scroll through, just double check that everything is done, come back, and when you can click the box, then that will essentially, this is our way of being able to say, yes, you're fully submitted. You do need to save and exit after doing that to make sure that it is saved, but there is no automatic submit option that allows you to know everything has gone through okay. So you can always ask your staff to confirm that things look good on our end, but know that if that checkbox is marked, you should be good. And then the check change control, cholesterol, and target type 2 diabetes program forms are going to be accessed the same way and set up very similarly by clicking add new at the top to get started, and then by clicking through all of the tabs to complete all of the required data. And I think that rounds out the demo. So with that, I'll pass it over to Allison to give us some resources and tips.
Great, thanks so much, Liz. I want to walk through a library of resources that has evolved over time, both in terms of reflecting the questions that you have asked us frequently, changes in the programs themselves, evolution of the measures, the attestation questions, and the award level. So there's a bevy of resources I want to walk through here. So first, on the next slide, I want to direct you to the Outpace CVD data platform website. The URL is here at the top of the slide. And from that web page, you can get onto the platform. You can walk through the steps of getting started with the very first step of registration. And it links you to many of the resources that I'm going to talk through here in a moment as well. So that's a great place, a real launch pad for organizations who are just beginning, and a real hub of resources for those returning. On this site, you'll also, oh, if you could back up just one second, on this site, you'll also find resources for each of the programs in terms of the data collection worksheets, the FAQs, the award fact sheets, and additional attestation question support. So I'm going to walk through each of those just briefly here, but they're all curated there on this page for you. So on the next slide, we'll start with, is particularly if you're an organization who is submitting for the first time, really encourage you to walk through that page, that web page that's outlined there at the top. There is both a PDF and a video that help introduce you to getting set up, making sure that you're choosing site characteristics that reflect your organization, because that's going to make your comparative benchmarking and dashboard data that much more meaningful and useful in your quality improvement efforts. It has some real basic information about data submission, much of which Liz highlighted in this webinar, and also give some tips on using those benchmark reports. So both the video and the PDF may be helpful to you. On the next slide, I want to highlight a deeper dive, and that is if you want to walk through a similar demonstration video to what Liz just walked through at a good clip, you can stop and start this one, and we'll go through sort of an A to Z, each of the screens using the actual platform. and show you where to enter what information. And it also highlights some of the nuances with check change control cholesterol and target type 2 diabetes. And there's also a quick guide for a quick user guide that you can reference as well. On the next slide, I also want to highlight the tried and true data collection worksheets. These are your friends in preparing for your data submission. So these have been updated, reflecting all the changes that I and Liz and I discussed earlier in terms of refinements to some of the questions that you'll be asked. So you can see them on paper essentially ahead of time. I think a lot of organizations use these to collaborate with their colleagues to collect all the information first. So you may need to turn to your IT, your quality improvement colleagues, your clinical champions to gather the data as well as the answers to the attestation questions. And so it's a great way to sort of have that conversation and round everything up before sitting down to do the actual data entry. I also think it's a great opportunity to reflect on your progress and your performance last year and have that conversation to start prioritizing your quality improvement activities for the year that we're in so that you can see even greater performance next year when you submit. On the next slide, I want to highlight the FAQ documents. There's one for each of the programs. Again, these have been informed by the questions that you have raised over the years, so they've been updated accordingly. Both FAQs about the data submission sort of mechanics themselves, the measures and their specifications, as well as the award criteria and levels. On the next slide, I just want to highlight for both for target BP as well as target type 2 diabetes, where there are practice attestation questions. This guide goes into a lot of detail on each of those questions, both giving examples of the intent of what would represent a yes answer, what might be a practice that would constitute a no answer in your response to those questions. And it has a lot of examples that actually might stimulate your thinking about how you want to strengthen or improve your practice going forward. It also has a detailed rationale for why we ask the question and where that ties to the guideline that is tied to that program or other evidence base. So what is why are we asking this question? Why does it matter? It also links to improvement resources, practice resources related to those questions. So it's a really practical and useful guide. And then on the next slide, I'll highlight, I know this question came up earlier in the Q&A. If you have 5 or more sites who are submitting their data individually and want to be sort of recognized and considered individually for awards, you can use the multi-site data uploader tool. This is a real time saver. So instead of going through that process 5, 6, 50, 100 times, which some large health systems would have to do if not for this helpful tool. So if you're interested in using this, essentially you're putting the answers in a spreadsheet and uploading it. You can request that spreadsheet through the contact us link that's mentioned here below, or you can reach out to your local American Heart Association Community Impact Director with whom you likely have a relationship, and they can help you get access to that as well. So we encourage you to use that if you have more than 5 or more sites. Next, I just want to highlight, in addition to a recording from today's webinar, we are also hosting 2 more office hours in March, one in March, one in May, where we'll have some prepared content and touch on some FAQs that have come up since today's program, but also a lot of open opportunity to raise your questions. We certainly encourage you to reach out in the meantime with your questions through the links provided or to your local AHA contacts, and we encourage you to join us. And as Liz has mentioned, to submit your data early. So with that, I'll turn it back to Liz.
Thanks, Allison. We're going to get into the Q&A and open up what has been shared through that channel. If you've got any final questions, please plug them in. But before we do that, I want to share a couple of wrap-up tips. First, we would love to register new organizations early. As we've reiterated time and time again, if you can enter and save your data as early as possible, we're going to be able to provide the most support. So we are so appreciative of you doing that. If you are looking through that laundry list, that beautiful library of resources that Allison just walked through, and you're like, okay, can you remind me, where do I start? Let's just go ahead and recommend the data collection worksheets and the quick user guide for the full content of the questions and the full instructions for how to submit. So those are your back to the basics. Give me two things. That's what I would give you. Three things I would send you to the website that has everything. And then finally, I wanted to remind you one more time that that data entry complete checkbox is going to be your friend. It's going to let you know that you're not missing anything. It's going to ease your anxieties. We're going to be all set if we check that box. And then as a final note before the Q&A, Allison's mentioned it, I've mentioned it, but the local American Heart Association staff, usually you're going to know them as your local community impact staff member. They know all about these resources. They can help you navigate on the platform. They can help with a multi-site submission tool. So they have a full suite of resources that's designed to help walk through that process of uploading a CSV file. Essentially, that's just a really great relationship to continue to lean on throughout the data submission process. And if you don't have that contact and you're like, wow, that sounds really good, we would love to connect you with that person, and we can do that through the contact us form. So moving to the Q&A, I'm going to have this up in case it's being asked. This meeting is being recorded, and we will share the slides following the call. It'll take us just a minute to get everything closed captioned and then sent to you, but we will for sure do that in follow-up. So let's take a look. Allison, I don't know if you have a Q&A ready to go.
Sure. It
No.
looks like most of the questions that people have asked have been answered in writing, but why don't we'll bring those up so that others who may not have been looking at the Q&A channel, we can highlight those. So that first, there were two clinical questions about validated devices as it relates to target BP. And one question was, are all devices that are for sale, are they all validated? And I wish the answer to that is yes, but it is not. And so as was stated in the response, any device, if you're wondering whether it's been validated for clinical accuracy or not, go to validatebp.org, and that lists all devices that we know have been validated for clinical accuracy. That means independently tested with patients who have different conditions. There may be devices that you have to be certain to check the model number. There may be devices that have been validated for accuracy but aren't on that list yet. So you can always reach out to your manufacturer to ask that question. And then the other question related to that I'll touch on was, do I only include measurements that have been taken on validated devices when submitting my data? Those are the answer to that is not, it's not necessary. You submit the measures that you have that adhere to the specifications of the measure. But that sounds like a great quality improvement opportunity. And I think this annual activity of submitting data is a great moment to reflect on where there are areas where your practice can more closely align to the evidence, and support your ability to say yes to those attestations in future years. So that's a great so that was one sort of pair of related questions that I wanted to raise. The other question, I'll turn to you, Liz, just to reiterate. Can you talk about the time period and the cutoff for the data that you gather to submit as it relates to both the measures as well as the attestation practices? And
Yes.
those tying to yeah, sorry.
Yeah, no, I see a couple different questions coming up here around, the measures and the time frame. So overall, the measure year that we are looking for is going to be from January 1st to December 31st of 2025. So all patients who had a visit during that time frame, that's going to be where we're starting at. When we're looking at the individual denominators, they are going to continue to look at that measure year, but there is a little bit of nuance in the blood pressure measure, as you mentioned earlier, Allison. So I'm just gonna give me just 2 seconds. I'll pop up the slide that we discussed this on. So because this is looking at patients who were diagnosed with hypertension starting before or continuing into or starting during the first 6 months of the measurement period. This is where it can get a little bit tricky. So we're looking at that initial diagnosis of hypertension from, I think it's July 1st to December 31st of the prior year. So that can be from, you can see this on the bottom row, where that initial diagnosis happened in November of 2024, so prior to the measurement year. So that one can get a little bit tricky. If you have questions as you're pulling this and you're like, wait, does this count? Does that count? Feel free to reach out, but that's kind of the general guidance, and it does go into more detail in the measure specifications as well. So that is from the measure perspective, what we're looking at. From a when you can share the information, we need all of the data to be in the platform by May 15th at 11:59 p.m. Eastern time to be eligible for an award. And I'll note the Eastern time, that can get a little bit tricky. We can go down the list of time zones, but just remember it's not midnight everywhere. We have many organizations participating West Coast, Midwest, out in Hawaii. We really value participation from everywhere. It's just that's when the report is set up to pull in the platform. So that's why we have the deadline at 11:59 p.m. It switches over with the new day, and we get a hard copy report essentially that we utilize for that purpose. Um, I did
Thank
see one other question around the denominator, so I'll try and tackle that really quick to kind of group them together. And Allison, keep me honest if I've missed any parts of the questions. But there was also a question if we were looking for the enterprise or the clinic that you're submitting for. And this can be really nuanced because we leave how organizations can register pretty open-ended. So we have organizations who are participating at an overarching health system level, and that's how they've registered. So if that was how you're registering, so you're submitting data for all of the clinics within your health system, then we would want you to look at all of the clinics and the denominator. We want that full representation. But if you are submitting for just one clinic and you're like, we're located at 12 Main Street in my local town, and that's the only clinic we have, and that's who I'm submitting for, but we're part of this broader statewide system, just focus on your local clinic because that's how you're capturing your data and answer that consistently through all of the questions. So that drills down into the attestation questions too. So if we're asking if you're training your staff on BP measurement once a year, once every 6 months, when that question comes up and you're looking at your whole health system, you want to make sure that you're providing that training for all staff who are measuring blood pressure in order to attest yes. So that's a bigger ask to be able to know that information across all of your clinics potentially. But that's just an example of how it would apply to both the denominator as well as the attestations. All right,
I'll
Allison,
just
keep me
I'll just
honest.
build on yeah, I'll just build on that comment, Liz, to say, some organizations who are starting out as new submitters may choose to just submit for one clinic in year one, and as they get their footing, then sort of add on other clinics in subsequent years, which you're more than welcome to do. That's your choice. There are two open questions that I wanted to raise. I'll direct the first one to you, Liz, and I'm happy to take the second one. But if an individual is having difficulty logging on to Infusario, how should they contact AHA? Should they wait for the reset? What advice do you have there?
Yeah, and that's a great call out about the reset, but I would say if you're ready to log in, that you can either, here we go. You have options. So if you're used to reaching out to your local contact, I would say go ahead and reach out to them directly. The contact us form, if you reach out to that, we usually direct back to the local contact. So if you know them already, that's going to be your fastest route, and they can handle submitting a ticket for you so you don't have to worry about it. But you could also contact the IQVIA support help desk, especially if it's just a password reset. They respond within 1 business day, so that'll get you in really quickly. But I will comment about the mass password reset. So if you haven't logged in for, I want to say it's about 90 days, your account automatically becomes inactive and does need to be reactivated. And because that is pretty common with organizations who haven't reviewed their data, maybe since last fall when the awards came out, then we do a single time reset of all passwords just for those individuals who have had their account deactivated because of that timeout issue. So we really narrow the list. We send an email usually about a week in advance to let you know that, hey, by the way, we're going to reset your password. Be on the lookout from an email. They come from AHA staff, which is infosarioutcomes@quintiles.com is it's a mouthful, but that's the full email address that you'll see with your password reactivation. So that's probably going to happen in like mid to late February. We want to make sure it gives a full window for that temporary password they send to be able to be used up through the deadline. So you can wait, but if you're ready to submit data, there's no need to. We can get you in there in like 1 to 3 business days
Yeah,
depending
we
on which
certainly
route
don't
you
want
take.
to discourage anybody from getting going on their data
Yeah,
submission. So don't wait for the last minute. Thank you, Liz. The other question that popped up was about validated devices. Again, somebody had asked if they had bought a Welch Allyn device that was relatively expensive and found that it was not on the Validate BP device listing. So it may be validated. Not manufacturers have to go through a process to apply to be listed on that website and provide sufficient evidence. It goes through an independent review committee. And so they may choose not to submit all of their devices. So you have a few options. One is you could contact the manufacturer to see if it has gone through independent validation. You can also encourage them to put it on the list and apply. And so that's those are sort of two pathways that you might consider to do so. Um, there
yes,
is
Allison.
another question. Sorry, go ahead, Liz.
Oh, sorry. No, I was just gonna jump in. I see a question about how many team members can have access to the platform and is there a limit? And there is no limit. You can have as many users per organization as is helpful to you. So it might be that you're splitting the workload and you want someone to collect all of the target type 2 diabetes data and someone to do all of the blood pressure data. I'd say make sure you're talking to each other because there is so much overlap, but you could definitely have a login for both of those. Or it could be that you have a data analyst who's plugging in the information, but you want to use it for quality improvement purposes and log in for the benchmarking reports. So there's a lot of reasons why you might want to have multiple users who know how to navigate and have access to that information. And you can just request them the same way you would request any account, but there is no maximum number. And
And Liz, one other
oh,
question popped up about the program agreement form, referring back to the email that was sent out on January 20th to organizations who have already registered. If you want to just comment on that revision and whether or not it needs to be re-signed.
sure. So it does not need to be re-signed. You can find it available online if you'd like to take a look at it. I believe it was linked in that, but it's also on our program websites. There aren't any major changes, but it was just it's an updated version. If you do have questions, please feel free to reach out about those changes. And this brings it all of the programs into alignment and just makes it a little bit easier to keep that consistent agreement form across all of the Outpace CVD programs.
Great.
And
Are
I think,
there any other open questions? I don't know if you have any concluding remarks, except to remind folks that this recording will certainly be available shortly.
yeah.
Any
Yes.
other words of wisdom?
Um, just a big thank you for attending this call. I know it's a lot of information to digest. We will, as you had called out earlier, have a couple of additional opportunities to ask questions. So if you're getting into it and you do come up with, any kind of question, really, we're here to answer. We'll be on those office hours. Your local staff is here to help. We just appreciate your continued support and look forward to celebrating with you all this fall with some awards. So just end with a thank you. And Allison, thank you so much for joining me today. Rebecca, thank you for being so fast at answering all of those Q&A questions and plugging in those links in the chat. And yes, we look forward to your feedback on the post-event survey, and we'll read those shortly. So I hope everyone has a great rest of your day.